This video will give a brief tour of the reticular fiber stain lung specimen and the elastic tissue stain specimen. As you may recall, reticular fibers are very tiny. They are rendered black with silver stain. They have a certain type of collagen they're made up of, type 3. And when we look into an enlargement of the reticular fibers, which are part of the stroma, compared to the parenchyma of the lung, which would be the functional cells, the type 1 and type 2 cells, and the lining epithelium of the various pathways in the lung. So if we zoom in on this square, you'll see this is a terminal bronchiole, and it's branching into a respiratory bronchiole and then into the alveolar duct and then individual alveoli out here. So when we look closely, you can now see the black staining reticular fibers that form a continuous network between the alveoli and the lung in the interalveolar septa. This is an interalveolar septa. This is also, and actually you see a type 2 cell here, and then the flat cells lining would be the type 1 cells. Also, the reticular fibers will form a network within the larger structures in the lung, like that as a vessel in the wall of the terminal bronchiole. You can see the reticular fibers. So as you look around and study this and see more examples throughout the lung, you will see that it is an extensive network of reticular fibers that give the lung its, let's say, integrity. Now the elastic fibers, in contrast, they give the lung a ability to stretch and then rebound. Like when you take in a breath and you're just breathing normally, and your diaphragm drops down and the lungs expand, and you're taking a breath, normal lung tissue allows you to just relax, and it rebounds, and the elasticity of the lungs expels most of the air in a normal tidal volume exchange, which is about 500 cc's of air is exchanged normally at rest. So now let's take a look at the elastic fiber specimen. Those will be a little harder to see. They're not as numerous as the reticular fibers. But as we zoom in, let's say on a bronchus. Let's see, is this a bronchus? Yes, there's cartilage here. This is cartilage here. This is the epithelium, and the elastic fibers are actually making a layer under this bronchus, which gives it elasticity. And then as we look, let's say, in smaller structures, let's say this terminal bronchiole right here. You see, there are elastic fibers here. And then if you look very carefully in the alveoli, you see there's one here in cross section, another one here, and a few over here. So they are forming a network, and they provide the compliance or the elasticity of the lung. Okay, so that includes the video tour of the 4 specimens of the lung.